Did you know every year in November, the world observes Lung Cancer Awareness Month, a campaign to raise awareness of lung cancer, one of the most prevalent and dangerous types of cancer. The objectives of the day is to raise awareness of lung cancer, promote early detection, and advocate for preventive actions. The lungs are a pair of spongy organs in the chest that handle breathing. They take in oxygen and release carbon dioxide. Lung cancer is a kind of cancer that starts as a growth of cells in the lungs. There are two primary types: non-small cell lung cancer, NSCLC. This is the most common type and includes subtypes like adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Small cell lung cancer, SCLC. This type grows more quickly and tends to spread earlier than NSCLC. Facts and figures. Lung cancer is the leading cause of death worldwide and is primarily related to tobacco smoking. In India, lung cancer incidence is projected to increase in 2025, with an estimated 81,219 cases in men and 30,109 in women due to factors like smoking and air pollution. India is the world's second largest tobacco consumer and the third largest tobacco producer. The Global Adult Tobacco Survey in 2016/2017 noted 267 million tobacco users in India, comprising 42.4% men and 14.2% women. Secondhand smoke (SHS) exposure is another major concern, with high prevalence in both workplace and home among 38.7% and 30.2% of adults respectively. Risk factors for lung cancer include tobacco smoking. Tobacco use in any form is harmful. Smoking is the number one risk factor for lung cancer. The toxic chemicals in tobacco damage the cells in the lungs, causing them cells to grow abnormally. Cigarette smoking increases a person's chance of getting lung cancer by 15 to 30 times, and these persons are more likely to die from lung cancer than people who do not smoke. In India, 87% of males and 85% of females patients with lung cancer have history of active tobacco smoking. Secondhand smoking (SHS). Regular exposure to smoke from other cigarettes can increase a person's risk of getting lung cancer, even if the person himself or herself does not smoke. Asbestos. Asbestos is a set of 6 naturally occurring fibrous minerals widely used in house construction materials, automobiles parts, and textiles due to its extremely durable and fire-resistant property. Asbestos fibers are microscopic in nature, and when inhaled, they get lodged in the soft internal tissue of respiratory system and can irritate the lungs. Occupational exposure to chemical carcinogens. Workplace exposure to arsenic, chromium, diesel exhaust, silica, and nickel can also increase risk of developing lung cancer, and the risk is even higher for those who also smoke. Family or personal history of lung cancer. People with a family history of lung cancer in first-degree relatives have an increased risk of lung cancer. Air pollution. Prolonged exposure to high levels of air pollution can be a risk factor. Infections in lung. Having had infections like chlamydia pneumonia or disease like tuberculosis (TB) that can lead to scar tissue formation in the lungs may have an increased risk for adenocarcinoma of the lung, a type of lung cancer. Signs and symptoms. Lung cancer typically doesn't cause symptoms early on. Symptoms of lung cancer usually happen when the disease is advanced. Signs and symptoms of lung cancer that happen in and around the lungs may include a new cough that doesn't go away, chest pain, coughing up blood even a small amount, shortness of breath, unexplained weight loss, wheezing, a high-pitched whistling sound while breathing due to narrowed or inflamed airways. Signs and symptoms that happen when lung cancer spreads to other parts of the body may include bone pain, headache, losing weight without trying, loss of appetite, swelling in the face or neck. Screening and diagnosis of lung cancer. Screening for lung cancer. Screening tests help identify lung cancer at an early stage, even before symptoms appear. Common lung cancer screening tests include 1. Chest X-ray. It is an X-ray of the organs and bones inside the chest. 2. Sputum cytology. This is a procedure where a sample of sputum, mucus coughed up from lungs, is viewed under a microscope by a pathologist to look for cancer cells. 3. Low-dose CT scan. LDCT uses minimal radiation to create detailed images of the lungs and detect small nodules or tumors. A clear diagnosis and accurate staging are essential for tailoring treatment to each patient, ensuring the best possible outcomes. Treatment options for lung cancer. Treatment for lung cancer depends on the type, stage, and overall health of the patient. Surgery, radiation therapy, chemotherapy, targeted therapy, and immunotherapy. Prevention of lung cancer. There is no proven way to completely prevent lung cancer, but there are steps to lower the risk of getting lung cancer. You can help lower your risk of getting lung cancer in the following ways. Not smoking. The best way to prevent lung cancer is to not smoke. People who have never smoked have the lowest risk of lung cancer. Quitting smoking. However long you have been smoking, it is always worthwhile to quit smoking. If you stop smoking before you attain 50 years of age, you can reduce your risk of getting lung cancer by half in the next 10 to 15 years. Avoid secondhand smoke. If you live or work with someone who smokes, urge him or her to quit. If not, request them to smoke outside. Avoid smoking zones in public places like restaurants and bars. Lower exposure to workplace risk factors. Follow your employer's precautions to protect yourself from toxic chemicals at work. Lung cancer is a serious issue that affects many people. Raising awareness and detecting it early can save lives. By understanding the causes and symptoms, you can take proactive steps for your health. If you have concerns about your lung health, please reach out to a healthcare professional. Your well-being is important.